This is an overview of an article entitled Tailoring the ACMG and AMP Guidelines for the Interpretation of Sequenced Variants in the FBN1 Gene for Marfan Syndrome, Proposal for a Disease and Gene-Specific Guideline, published in the June 2018 issue of Circulation, Genomic, and Precision Medicine. Accurate variant interpretation and precise classification are critical for diagnostic, therapeutic, and genetic counseling processes. In 2015, the American College of Medical Genetics and Genomics and the Association for Molecular Pathology, or ACMG-AMP, published new guidelines for the interpretation of sequence variants in genes associated with Mendelian diseases, providing a common and more detailed framework for variant classification. The guidelines recommend variant classification into pathogenic, likely pathogenic, variant of uncertain significance, likely benign, or benign categories, and the evaluation of population and genotype-phenotype data, literature and locus-specific databases, computational and functional data, co-segregation analysis, and allelic data. However, the implementation of these guidelines remains challenging because some of the proposed criteria are still open to subjective interpretation. The incorporation of disease and gene-specific characteristics could help to optimize variant interpretation. In the study under discussion, the authors applied the new guidelines for the interpretation of variants in the fibrillin-1 or FBN1 gene by taking into consideration gene and protein-specific characteristics. Mutations in FBN1 are responsible for Marfan syndrome, which is an autosomal dominant inherited connective tissue disorder affecting multiple organ systems. Currently, the diagnosis of Marfan syndrome is based on the revised Ghent criteria, according to which, in the absence of family history, the combination of aortic root dilatation or dissection and ectopia lentis, or the combination of aortic root dilatation or dissection and a positive systemic score, will establish the diagnosis. While molecular analysis of the FBN1 gene is not necessary for the diagnosis, the identification of a pathogenic FBN1 variant is helpful in those patients presenting either partial features of Marfan syndrome or related disorders with overlapping features, such as Loeys-Dietz syndrome, MAS phenotype, which stands for mitral valve, myopia, aorta, skin, and skeletal features with the disorder, or mitral valve prolapse syndrome. This is a schematic representation of the FBN1 protein and the calcium-binding endothelial growth factor-like domains, or cb-EGF domains. Each cb-EGF domain contains 6 cysteines, which are pairwise connected through disulfide bonds. Disruption of these bonds has been shown to render the protein more vulnerable to proteolysis and most likely affect its function. The authors adapted 15 of the 28 general criteria of the new ACMG-AMP guidelines to better fit the FBN1 gene and Marfan syndrome specific characteristics, and they identified a total of 713 FBN1 variants and 934 unrelated probands with a mean age of approximately 26 years. This figure shows the types of variants identified in FBN1. The majority were missense variants affecting a cysteine residue either in or outside a cb-EGF domain. Frameshift, nonsense, splice site, in-frame indel, and synonymous variants were also recognized. The authors found that there was moderate agreement between the new adapted guidelines and the old practices, with a kappa coefficient of 0.6. This graph depicts the differences in classification between the old and new criteria. In this study, 73.8% of the variants were reclassified as likely pathogenic, whereas the majority of the variants had been classified as pathogenic according to old practices. The overall proportion of variants of uncertain significance increased from 14.5% to 24.2%. 14 variants were downscaled to likely benign, and 1 variant was upscaled from variant of uncertain significance to likely pathogenic. Notably, 59.7% of the downscaled variants from pathogenic variant to likely benign or variant of uncertain significance were missense variants outside a cb-EGF domain and not affecting an important functional site. In decreasing frequency were missense variants affecting either a cysteine residue outside a cb-EGF domain or an amino acid in a CB site, splice site variants outside plus or minus 1 or 2 positions, frameshift variants in exon 65, in-frame variants, synonymous variants, and nonsense variants in exon 65. In summary, variant classification and interpretation are of major clinical significance. In the paper under discussion, the authors have refined some of the criteria of the ACMG AMP guidelines to tailor them to the specific characteristics of the FBN1 gene and its protein product in order to allow a more precise and consistent interpretation of FBN1 variants. Gene-specific guidelines may contribute towards a more precise and uniform interpretation of the variants in order to accurately support clinical decision-making.